Alton. I am the physical therapist here at Illinois Regional Pain Institute. And we're going to talk today a little bit about what the effects are of chronic pain on the rest of your body. Okay. My hope is that today will connect some dots for you. Okay. We oftentimes are like, I was fine until X happened, or I was fine until, I had that car wreck, and then all of a sudden now, 2 years later, I'm on blood pressure medication, and then a year after that, I'm diabetic, and so on and so forth. And so a lot of times what people, the exception is the people that grew up with some of this, but basically, your body is not betraying you, and that's what it feels like. It feels like your body is just falling apart and it's betraying you, and it's not doing that. It's in crisis, and it's doing its level best to take care of you and to make sure that things are running as best as they can. And the other dot that I want to connect a little bit is the why you keep hearing the same old, do these other things, like relax, practice relaxation techniques, meditate, eat better, sleep more, all of these things, okay? So I hopefully will go through some of these things and say, this is why these different interventions will help this particular area. And if we can take this stress down in one area of the body, that will help the rest of the body have enough resources to deal with stress in other areas, okay? There is a biofeedback loop. If one area is in crisis, it'll keep the whole system up and running and up in arms. But if we can get one area to kind of calm down, that can also signal the body to then calm down some of the other things. Okay? All right, so that's kind of what my goal is for today. You have two handouts. One of them is because I forgot to add it into the first one. So we're going to go with the big one first. So basically, most of this stuff is adapted from the Women's Health Physical Therapy, volume number 35. But it basically goes through what happens. So what happens when you have a stressor in your life for a really, really long period of time, okay? And so what I want to do kind of is go through what happens when a bear walks into the room, lumbers into the room, okay? What happens to your body initially, okay? There's a lot of freak out going on, right? Okay, so your pupils will dilate because we need to see more of what is happening, okay? Our breath will start going faster because we need more oxygen to the muscles, okay? Our blood automatically starts shunting from the long-term muscles that hold us upright and go to the big muscles that are going to help us fight the bear or run away from the bear, right? All right. Our heart starts beating faster and harder in order to make sure that the blood gets to the muscles that it needs to go to, okay? So our blood pressure goes up, our eyes dilate, our eyes start moving everywhere, our breathing starts going faster, our heart rate goes faster. Okay, our digestive system shuts down because we don't need to digest a sandwich if we're fighting a bear, right? Right? We may not even need that sandwich if it goes badly, right? So why use those resources there when we need to be fighting the bear, right? Our reproductive system shuts down, okay? Because who needs that when we're fighting a bear, okay? Who needs that? So all of these things happen. So what happens if the bear never leaves the room?
You give him the sandwich and you leave the room.
right, there you go. I like your answer. So that's what happens with a lot of us when we have chronic pain. That is the bear, and the bear never leaves the room. Okay, we have stressful family situations that may not get resolved in any short length of time. These kinds of things, these stressors, are all fight or flight, and our bodies don't necessarily know the difference between an actual bear, the threat of losing your job, the threat of losing your home, or an argument with somebody that represents some stability in our world. Okay, Especially when, as a child, if you think about it, like arguing with somebody who helps you pay the bills, who you're a little bit dependent on, whether you're interdependent even, in order to maintain the household, that's a really threatening situation. Because from when you were born all the way up until, a certain age, whether it's, 16 or 18 or whenever it was that you left the house and went on your own, you were dependent upon their approval to feed you, to put a roof over your house, to give you clothes and stuff like that. And whether or not it was a good relationship or a bad relationship, that implicit power imbalance is there, and we carry that as we go through our lives. So when we argue with somebody who is somehow related to our well-being and our ability to be on our own, whether it's a boss or a spouse or whatever, we kind of, that triggers a lot in us. Okay.
Yeah, it does.
All right. So there's pain. There's lots of other stressors that can be involved in this whole thing. But typically, for this group, there's a lot of pain in general, or even just global health concerns. Okay. So the question for today is, what happens when the bear doesn't leave the room? What happens 2 years down the line to these different systems when they're kept in this fight or flight mode? Okay, because really, if you think about it, if it was a real bear, this altercation is over in a couple minutes. Whether one way or another, you either lose or you win. This is done and over with in a couple of minutes. And then if you win, great, that's wonderful. You still have to kind of, assess the situation and deal with the aftermath of it. But the actual fight or flight is only meant to be active for a few minutes at a time. Okay. All right. So the first thing that I have down is the motor system. So remember when I said that the muscles, the blood gets shunted from the long-term postural muscles and gets shunted to the larger muscles in your arms and in your legs. Okay, and that's in order to either fight the bear or run from the bear. Okay. So what happens when we have long-term blood loss to the area of where we're holding ourselves up? Okay, we have problems holding ourselves up. Okay, the muscles, they don't work the way they're supposed to. Okay, they're weaker than they should be. We start having pain because they start to complain if we've asked them to do for too long when they don't have the blood flow in order to do it. Okay, so the core can become weak. The blood flow to those muscles decreases. The firing order can get kind of confused. Okay, so when muscles fatigue, if you ever do you guys remember the bent arm hang? Did you have to do that in school for fitness tests or whatever, where you had to do the bent, or the girls did anyway, they had to do the bent arm hang, and they'd be hanging there, and they'd be shaking, and they'd be shaking, and they'd be shaking, right? Remember this?
I do, yes.
Okay, so what happens when you use a muscle for a really long period of time is the firing order doesn't quite maintain, okay? And the reason for that is because it's kind of, I think of it as an engine with like 6 cylinders. So we have motor units that comprise the whole muscle. Okay, we have 6 or 7 of these, well, I don't know how many, but we have several of these within the muscle. And one motor unit will squeeze, then the next it'll let go, and the next one will take over, then the next one will take over, next one. Okay, so when you start to get fatigued, what happens is this one will let go, and the other one goes, oh yeah, that's right, I'm supposed to do this. And the other one goes, oh, that's right, I'm supposed to do this. So we kind of get this shakiness. And when you're really, really fatigued or really, really in pain, you start to get the shakes. Yeah. Or you start to get this thing where you try to reach up into a cupboard, and instead of nice, smooth movements, you go like an Etch-a-Sketch. Right? Because your body's not coordinating that very well. And it can either be from a fatigue of muscles, or it can be a fatigue of the nerves themselves.
Is that like a defense that you're setting up, or no?
Huh?
Is that like a defense? No?
It's a defense that's been used too long.
Too long.
Okay, so those muscles and those nerves are fatiguing. Okay, and that's just kind of what that happens. And so what that feels like is you get the shakes, You get this kind of cogwheeling. You just kind of, you're like an Etch-a-Sketch. You kind of can't quite get that nice smooth reach to one thing or another. You feel really discoordinated. Like, I swear I haven't drank anything this morning. You know, you just kind of feel a little bit off like that. You really also can get the sense, and this happens not to everybody, and not everybody gets all of these symptoms, but you can get the sense that you can't regulate the amount of force that you need in order to use your muscles correctly. So if you've ever walked up into the refrigerator and somebody put the milk back empty, and you reach in and you grab the milk and you're expecting it to be full, and it goes dunk at the top of the, right? On the top of the, okay, so that's kind of what that you use too much force to lift something too light, okay? And so you get this feeling like you just can't, like you try to lift up your purse or your backpack or something, and you can't, like, oh, I need to use more, or, you know, you just, like, you just become clumsy, you know? I've taken a drink before, especially when I was really bad. I would take a drink and it would like hit my teeth with the cup because it was like I was completely off as far as how much force I needed to use to raise the cup to my lips. Okay, and so that sort of thing can happen. So when people come in here for PT and I talk to them about it, and they're like, I just don't understand. I'm shaking all over the place. I'm like, that's pain. Yeah, that's pain. You're not making that up. You know, now granted, there are other things that can cause this sort of thing, but for the most part, that's typically what we're seeing. Okay, all right. So the next one we have is fight or flight system, the sympathetic nervous system. Sympathetic nervous system is what we call the fight or flight nervous system. Okay, this is the part of the nervous system that's responsible for helping you respond to that bear. Okay. If it's left on, the thing about it is that the neural system and the immune system are so closely linked that they're actually starting to call it the neuroimmune system. Okay, and they're starting to realize or talk about immune cells as though they were mobile nerve cells. Okay, so when we are fighting a bear, our immune system turns down for a little while. Okay, because you don't need to heal the flu. Right? You don't need to heal your infection. You don't need to, heal the cut while you're fighting a bear. It may or may not be relevant in 2 minutes anyway, right? Okay, so we turn down that immune system. So if that gets left on, the immune system and those cytokines, they interrupt our sleep. They stimulate cortisol, and they increase blood pressure, okay? So cortisol, just real quick, cortisol is a stress hormone. It comes from the adrenal glands that sit right on top of your kidneys. All right, basically it ordinarily prepares the body for the repairs that will be needed when the stress is over with. So it's busy working on trying to get that code orange at the ER set up before the mass trauma event comes in. It's like making sure that there's enough resources there. It's in the background, but it also calls for sugar to help us to the bloodstream to help us to fight the bear. Okay, it increases blood sugar. So without cortisol, you die. Okay, so it's just too much cortisol that becomes an issue, and we have too much blood sugar running around in our system. And what happens if we don't use it actually fighting a bear? We put it under the mattress, right, where it's easy to get to later on. Okay?
Like fat you're talking
Yep. Yep.
Just say you put a bear on the mattress. I wouldn't agree with that statement.
Huh? What's
You
that?
can't put a bear on the mattress. I wouldn't.
No,
That's a bad
the
idea.
extra energy.
So the more scared we get, the more we lose? Is that what?
No, actually, no. You end up gaining more in the belly
More,
because that's where that's under the mattress. That's the extra energy, right? Yeah. All right. So increasing blood pressure. So this is where your smaller handout comes in. So
We can't like hire somebody to Freddy Krueger us and get rid of all that. Just
yeah,
not gonna happen.
No, actually,
Alright.
that's going to backfire. Actually, backfires
in many ways.
So, okay, so blood pressure, kidneys and your heart and your adrenal glands and a bunch of these players work together very, very closely to regulate blood pressure. Okay. There are a couple of places where blood pressure is measured on a pretty direct level. One is in the kidneys, because the kidneys need an exact level of pressure in order to function correctly. Okay? In order for that filter to work exactly the way it's supposed to, it really needs precise amount of pressure. And the other is in the carotid arteries. You have some barometers up here in the carotid arteries to make sure that you're getting enough blood up to the brain, because that's kind of important. Right? If you've ever held your breath.
Not to everyone.
Well, and if you've ever held your breath because you're having a temper tantrum, you know why. All right. So, so if the blood pressure is too low inside the kidneys, there's a bunch of steps, and I listed them out here, but basically, hormone gets produced by the kidneys saying, hey, I'm needing more blood flow here. Okay, that will go to the liver, and the liver will send it on to the lungs, and the lungs will send it on then to your blood vessels and to your adrenal glands. Okay? And what it does to the blood vessels is it makes them constrict. Okay? So that provides a little bit more resistance through the rest of your body. And then it also decreases the amount of volume that the blood has available to it, so it'll feel like there's more blood volume initially. Okay, it sends information to the adrenal glands to stimulate what's known as aldosterone, which goes to the kidneys and says you need to retain water, you need to retain sodium, and you need to get rid of all this extra potassium. Okay, all right. The other things that happen is that epinephrine and norepinephrine, which are also known as adrenaline, are hormones, and also sorry. It's a baby. It's okay. They're hormones and neurotransmitters that they actually also get secreted by the adrenal glands. Okay, they raise blood pressure by increasing heart rate and contractility of the heart, so that it tells the heart to pump faster and harder. Okay, this is why when you are faced with a bear, that adrenal gland gets set up. This is why your blood pressure goes up, because the adrenal gland sends out epinephrine, and its job is to tell the heart, beat harder, faster. We need more blood to the tissues. Okay, especially the muscles. Okay, and it also can cause more vasoconstriction in the arteries and veins. And these hormones are also, like I said, part of the fight or flight response. Okay. The other thing that happens is we have an antidiuretic hormone, which is produced by our hypothalamus, which is in the chest here. It's released by the posterior pituitary gland, and it raises blood pressure by stimulating the kidneys to retain water. Okay. All right, so now what happens if the blood pressure is too high? Again, hormones change how fast the heart beats and how hard. It can relax the blood vessels to make it harder or easier for blood to flow around the body. So we have one that's secreted by the heart itself, that goes back down to the kidneys to tell the kidneys, we need to get rid of some of this blood volume, get rid of some of this water, get rid of some of this sodium. Okay? We have nitric oxide. Anybody had that at the dentist? Makes you kind of
I keep asking.
Yeah, they won't do it.
They just won't do it.
It's released by your body's inflammatory response. Okay, and basically what it does is it causes all your blood vessels to relax. Okay, and it also relaxes other things in the body, which is why they use it at the dentist, or they use something similar at the dentist. Okay. But what happens, so we have this thing that comes from the heart itself to tell the kidneys to excrete more water, excrete more sodium. What happens when we have our adrenal glands, who is constantly staring at this bear, going, adrenaline, heartbeat faster, heartbeat longer, heartbeat. Okay, so we have this extended period of higher blood pressure. Okay, as much as that heart is going to say, I'm getting tired. We need to lower this. We need to chill. We still have that adrenaline, and that's far stronger. Okay.
So is that how cocaine works? It like makes your body think it needs more, and then
I don't know. I actually really don't know how cocaine works.
Is that? I was just wondering. Is that
possibly
kind of the
possibly it raises heart rate, right?
Yeah, put your body in sort of a flight or fight.
So so one of the things that is really interesting about the body is that if one area is in fight or flight, pretty much everything else will catch up. So if you find yourself breathing really hard because of something, it will kind of induce a fight or flight response. Okay, so my favorite example of this, and thank you to all dentists who did this to me and didn't tell me that they were doing this to me, is that a lot of times along with the lidocaine that they give you, they will also give you a little shot of adrenaline. Okay, you never had that happen? What it does is it constricts the blood vessels so you don't bleed as much, right?
Who's your dentist?
I've got a lot of them. I've had a lot of them. But you get this wash of, oh my gosh. And so you think you're having a panic attack sitting in the dentist chair, okay? It's really just that the adrenaline, so one part of the body, the nervous system, is noticing this adrenaline rush. And so now all of a sudden, okay, we're responding as though we're having, and my brain is responding as though I'm having a panic attack and so forth.
So it all gets put on notice if there's one.
If there's one that's off, then everybody else is on notice. The nice thing about this is if we can get one area to calm down, the rest of the areas will tend to follow as well. So that's a nice counteract, okay? So things that can change your blood pressure, your nervous system stimulation, we've talked already about pain and stress, caffeine, tobacco, hormones. So anybody that's been through the change of life will tell you that hormones can make you feel like, whoa! Okay. Substances derived from the inner lining or the endothelium of blood vessels. And so the reason why I wanted to mention this real quick is because we talked a lot about doing monitoring for increased inflammation in the rest of your body. This is one of the reasons why inflammation is a problem. Okay, because if there's inflammation in the blood vessels themselves, okay, that can kickstart a fight or flight issue. Okay, that kickstarts the fight or flight issue. All of a sudden, everything becomes more sensitive, and we'll go through that in just a minute. That's another thing. But everything becomes more sensitive. Reasonably so. You want to be really aware of your surroundings if you're fighting a bear, right?
Right.
So, the whole thing is, so that if we can get the inflammation to come down within the endothelium, within the lining of the arteries, then maybe we can settle the whole system down as well. Okay? It's one step in the right direction anyway. Okay? Alrighty, and then I left a couple of things here about nicotine and alcohol, about how it raises and lowers blood pressure. You can kind of read that on your own, just kind of a little, the more you know kind of thing. Alrighty. So what can you do about this sympathetic nervous system? Educate yourself about your condition. So the fewer unknowns you have about what's going on with you, the less you're gonna fear it. Okay? The more you know that, this shaking and kind of this cogwheeling when I'm having a bad pain day is kind of a normal thing. I'm not thinking, am I getting Parkinson's disease? Am I getting MS? Do I need to go get to a neurologist? And so that can raise up your fight or flight system. Okay? So educating yourself on what's going on with you can really help. Meditation practice, relaxation can help lower that baseline arousal of the nervous system, so that when things do happen, you're kind of at a lower level and it takes a little bit more of that stimulation to get you up and over. Okay. Alrighty, next one. The endocrine system. So this goes to all of your hormones. So in long-term fight or flight states, it shuts down what isn't needed. The reproduction, the digestion, the wound healing. Okay. And we kind of went through that already. You don't need to digest the sandwich or the pasta when you're fighting bear, right? You don't need reproduction necessarily. You don't need to fix the cut on your leg. Okay. What's interesting though too is that if you live on, we have increased cortisol, which comes again from the adrenal glands and increases the blood sugar. Okay. This does a couple of things. You die without cortisol. It uses the same building blocks as your other sex hormones. Okay? If your body has a choice between sex hormones and cortisol, guess which one's going to pick?
Cortisol.
It's going to pick cortisol because that one's going to keep you alive. Okay? So a lot of people that have chronic pain end up with, low libido, low testosterone, problems conceiving, all kinds of issues that are associated with their reproduction because the body's using those building blocks for the cortisol that's necessary for survival. And really the sex hormones, that's kind of a secondary thing, okay? But the other thing that happens is that we have increased cortisol, which increases the amount of blood sugar in your system. So what happens when you have blood sugar? Diabetes, okay? So the body responds with, we have all this extra sugar in the blood. We need insulin to put it where it belongs. Okay? So if we don't use it in the muscles, then it puts it in fat cells to store it. Okay? If we keep on with this cycle of always needing sugar, because we're always on high alert, and so we always need the insulin to help maintain proper blood sugar levels, and we start to fatigue out these organs. Okay, we start to fatigue out the pancreas, and what happens then is that the insulin stops becoming as effective, and or you stop producing as much of it as you need, and you get diabetes. Okay. So what this can feel like is depression, weight gain, decreased sex drive, poor healing. Okay, so one of the things you can do is really eat well to support the nutrients that that are needed for the hormones. Okay, so making sure that you are getting your vitamin D, make sure that you're getting, all of the vitamins that are necessary to make the hormones. Okay, so that your body has the resources it needs to actually make, has both the cortisol and the other hormones. Okay. Also, as far as maintaining, doing what you can to maintain an even blood sugar level. And that means kind of staying away from the sugars. Okay, staying away from the really simple carbohydrates. Okay, because what that does is spike it up, and then the insulin comes in going, oh my gosh, we got all this sugar, we got to put it somewhere, right? Okay. So that fatigues that out as well, and if we can keep that from happening, that cortisol or the pancreas will last a little bit longer. Okay. Relaxation meditation can again help calm the system, reduce the need for adrenaline and blood sugar. Okay. All right. We're starting to kind of connect some dots for everybody here. Starting to kind of make some sense that your body's really doing what it can to keep you alive. Okay. All right.
Mine seems to be like in a perpetual survival mode.
Yeah, that's what this is.
For like 30 years.
Yeah, that's what this is. That's what this is. Okay, so the immune system. What happens with the immune system is that so again, remember we talked about how the immune system changes when we're faced with a fight or flight situation. It turns it kind of down and then does things to prepare for a code orange later on, mass casualty event later on. But it kind of puts a halt on all of your major healing issues. So if you leave it on, one of two things can happen. You can either get an underactive immune system or you can get an overactive immune system that tries to compensate for this chronic low level, this chronic trying to turn down. Okay, so either the immune system can go, yeah, we'll go along with that and be underactive, or it can go, oh heck no, we need to fight the world. Okay, so it can do one of those two things. But basically what happens is it stops recognizing what is you and what isn't you. And that's what your immune system is there for, is to recognize this is me, this is not me. Everything that's not me pushes it out.
That's what we call it overactive imagination, right?
Possibly, yeah. Yeah. Especially if you imagine that they're actually little workers.
Yeah.
Right? Okay.
Those are ants.
Little worker ants.
Yes.
Oh, great. Now I have ants crawling over. All right, so this, the first response is to create inflammation, and this can set off the chain reaction, as well as being irritating to the local nerve endings and motivating you to protect the area. So we have some inflammation. The inflammation in and of itself is painful. The reason it's painful is because if you just broken your arm, it's there to remind you, hey, slow down, buddy. We're not done with this reconstruction yet. Okay? But if you have inflammation in an area that doesn't necessarily need construction, then you have some, hey, slow down, buddy, for no real reason. Okay? So the underactive immune system, what that looks like is the stressor, the body stops enhancing and will further, okay, so we have this part of the immune system that's getting ready for this mass casualty event. This mass casualty event never happens. So the guys, that are preparing for this go, well, we may as well go back to what we were doing before, which is nothing, And furthermore, we don't need all these bags of own eggs sitting here, so we'll put those back in the fridge, right? And it says, it's like, okay, well, we don't need all of these gloves out, so we'll put them back in the cupboard and everything. So they start to put everything back where it belongs because it's not needed. The body's really smart. If something isn't being used, it's not going to maintain it. It's not going to do what it needs to do to repair it. Okay, so you'll probably notice that it takes about 4 weeks to get into shape, maybe longer. And about 4 days to get out of shape,
Yeah.
right? When you get sick, you notice a huge difference, right? And that's because for 4 days, you weren't using those muscles. So the body went, ha, we need those resources somewhere else. We take them, because we're always in a process of constant regeneration, right? So as it takes things down, it goes, do we need to rebuild this or not? We haven't used that in 4 days. Heck no, we don't need to we can use that resource somewhere else, okay? And so as your body doesn't need this for this mass casualty event, it'll stop doing it. Okay?
So is that why it's important to use what you have? Or
It
try?
is. It
Because
is.
if you don't, you're going to lose
Yes.
a lot.
Yes.
Yeah.
Yes. If you don't move, you will use it. If you do not move your back will eventually assume that you don't need to move it, and it'll not, I won't say scar it down, but it will stick things together so they don't move as well. It'll make them more stable. Seen that happen with shoulders quite a bit. With frozen shoulder,
Yeah.
somebody doesn't use their shoulder because it really, really hurts, and then pretty soon you've got all this scar tissue and stuff, and it cannot move. The doctor can pull it, and it won't go up any further than that.
How do you avoid that?
How do you? Well, it's a long and involved process, but basically gentle motion, as much as you can do without really setting off.
Preventative care.
Yeah.
And then,
Yeah. So basically, then your immune system breaks down, doesn't work as well. It can't tell who's you and who's not you anymore, and it doesn't stop the invaders because there's no resources to do that. So if this gets really bad, you might stop getting sick altogether. Okay, but typically people just kind of, I'm sick all the time. I can't ever shake it. I'm just kind of sick all the time. But it can get to a point where you don't get sick at all. You think your immune system works great because you never get sick. And what's happening is you're not getting sick because your immune system isn't
shut off.
It's shut off, and you're not getting any symptoms. The symptoms are your immune system working. So when you get a cold and you have this leakage happening all the time, that's your body getting rid of all the old, dead, gross white blood cells that have done their job and killed off whatever it is that needs to be killed off. Okay? If you have a sore that has pus, that's old, dead, white blood cells that are getting rid of it, okay? So all of these symptoms of getting sick are really your body's immune system. That's what you're feeling, is your immune system, okay? Not the actual bug.
I don't know if that's really cool or really scary. It's really
Kinda
neat,
some of both.
but it's scary. I'm not sick. I haven't been sick in like 6 months.
Well, 6 months, that's not a major deal. It's not getting sick in like
Okay.
5 years.
Okay,
Or
all right.
6 years that we start to kind of get worried
I
that,
see, like, okay.
6 months is pretty normal.
What do you say is sick? I would say I haven't been sick in years,
Mm-hmm.
but I have things go wrong, like the joints of my neck, and I always have to go to chiropractor.
Right. I would say that what I mean in this case by getting sick, I mean catching a cold, getting a bug, a flu virus, something like that. Okay. It's pretty normal for us to go through maybe a year without getting sick, but then maybe a year where you get sick a couple of times. It's pretty normal to go through that. Okay. And if you're around people at all, that's going to happen. So while you're convalescing from this, you can avoid exposure to illnesses and get your vaccinations. Yes, I said get your vaccinations to YouTube audience. Good nutrition, and plenty of sleep. Okay, because those are all things that the body heals when it's sleeping. So that will help with that. All right, so overactive immune system looks like the opposite. That's your autoimmune disorder. That's your body attacking itself, essentially. What we think. There have been some new theories that have floated in the last year or so that say that your body isn't actually attacking itself, it's attacking a small pocket of illness within the cells that it's attacking. The jury's still way out on that, but that's a new theory that's comes out, and it actually kind of makes a little bit more sense to me. But, that's neither here nor there. I mean, there are a lot of things in this world that have been proven true that don't really make much sense, so, so I'm not the litmus test there at all, but basically, in this case, the body's triggered to treat everything it encounters as an invader, even if it's your own tissue. And we're really, really not sure why that happens. But again, like this new theory kind of makes sense that that's why it's happening. But at this point, we don't know why that happens. We just know that it does. And so what can you do for that? You can explore ways to decrease inflammation, including dietary changes. Again, good nutrition, plenty of sleep, pacing stress and activity levels. Okay. It's fine. Oh, wow. Have a good one. It's good to see you.
Yeah, see you Monday.
All right, see you. Okay. So the parasympathetic nervous system. So remember we went through the sympathetic nervous system. This is the one that helps you fight the bear. This is the one that actually helps you recover from the bear. Okay. And so if the sympathetic nervous system is left on, the parasympathetic nervous system never kicks on to help you recover. Okay. And basically, this system is responsible for returning your body to normal after the emergency, promotes healing of tissue damage. I call it rest, relax, and restore. Some people call it rest and digest, because its job is to turn the GI system back on, okay, and kind of get things to move in that direction, okay. If it's not successful in returning to normal, you get some poor healing. You can get vascular migraines. Remember that some of our adrenaline, its job is to constrict the blood vessels. So a lot of people that complain of vascular migraines, that's a constriction of, it can be a constriction of blood vessels. Sometimes it's an extra dilation of blood vessels, but it's one of those things that it can be associated with that, okay? You can't rest, you can't fall asleep, you can't relax, and you have really poor digestion. And that can either mean that things are moving way too fast or things are moving way too slow, okay? All right. What can you do about that? Light exercise and movement to improve blood flow and use some of those resources. All right, use up some of the adrenal and use up some of the cortisol and the blood sugar and all of that. All right. meditation, relaxation to kind of kickstart that parasympathetic nervous system to give it that cue. Okay, it's time for you to turn on. We're over the event now. We can relax, or maybe we're not over the event now, but we have to give our bodies a place to rest. Okay. Good nutrition, obviously. Eye movements and breathing. I don't have this on the handout, but these are two ways. Remember I said that if one is upset, one area is upset, then the other areas also get, it's kind of like having a room full of toddlers. One starts screaming, they all start screaming. Okay. This actually, our bodies actually do work the opposite way, that if you can get one toddler to calm down, then all the rest of them will help to start calm down too. It doesn't work that way in real life, but it does in our bodies. Okay. So eye movements, if you are running or fighting a bear or whatever, our eye movements tend to get real quick and real jumpy, okay, because we're looking everywhere. Where's the nearest tree we can climb, as we're running? What are things I need to jump over? Where is the bear now? Is there any other threats? What's going on here? So that the eyes are constantly moving. And so we can slow down those eye movements and stretch those eye muscles, because as you lose muscle a whole lot, remember what happens? It starts to jiggle, it starts to, it starts to get fatigued, it gets really tight, right? Okay, same thing happens with these eye muscles. So if we can move them down as slowly as we can, as far as it'll go, and you feel a stretch, and go up as slowly as you can, as smoothly as you can, up as high you can feel a stretch. Same thing side to side. This is really hard to do without jumping and skipping ahead, because your brain and your eyes are both going, oh wait, you want to look over there? We'll just look over there. That's easy. Okay, no, we want to go as slowly as we possibly can, because that sends the signal, oh, our eyes are moving slowly. We must not have anything we're running from.
That's a great trick, really.
Okay.
That works.
It does work, and that's sometimes the last thing I do before I fall asleep at night.
I'm going to start doing that.
Okay. The other thing is, so we have unconscious, our bodies have unconscious control over our eye movements, and we have conscious control over our eye movements. And this is why it's a way into the nervous system.
Wow.
The other thing that we have conscious control over and unconscious control over is our breathing. Okay. So this is why everybody's like, deep breaths, deep breaths, deep breaths. And you're like, oh, for crying out loud, I breathe already, This is why. It's because every time you breathe in, our bodies are going through this constant calibration of our arousal throughout our entire day. Okay? Every time you breathe in, you activate your fight or flight system. Okay? Every time you breathe out, you're activating your rest, relax, and restore system. Okay? So if we need more arousal, we need more attention, we need more energy. If we breathe harder, higher, faster, okay, this is the chants that are at the football game, this is the rah-rahs, this is the, this is the all that excitement and that yelling and that, that up, okay, we're breathing higher, faster, okay, and raising energy. Okay, same thing works for breathing slower, breathing out. When you breathe out, you activate that rest, relax, and restore system. You can kind of give it a chance to catch up a little. Okay, this is not going to happen in 1 or 2 breaths. Okay, given how fast, how activated our typical systems are. Okay, this isn't going to happen overnight, and this isn't going to happen the first 2 or 3 breaths that you take. But if we can spend more time breathing out than we are breathing in, then we can kind of allow that rest, relax, and restore system to kind of take over. Okay, all right. So a couple of examples of those types of breathings are the 4-7-8 breathing. So you breathe in for 4 counts, hold for 7, and then breathe out for 8. Okay. And then in 4, 7, 8. 4, 7, 8. I mean, so you're not holding anything out. Okay. That one works really well for some people. My absolute favorite is breathe out and wait. Okay, this can freak some people out, especially if you have an issue with breathing. But this one, what you do is you take a nice deep breath in, you breathe out, and then you don't breathe in. Okay? And that's like kind of disconcerting because you're like, but I need air. Okay, know that you got plenty of oxygen flowing around in your veins right now. You got plenty of oxygen. You can go for 3 minutes without breathing. Okay. I wouldn't recommend it necessarily, but you can go for a while without breathing, right? Okay, so, and you have plenty of oxygen that's still in your lungs. Okay, so even though you have breathed out the whole way, you still have some left over. Okay, so if you breathe out and you wait and you just see how long does it take? How long before, you know, you're going to want to breathe in, just wait. I want to breathe in, well, just wait. I want to breathe in, just wait. And then when you finally do allow yourself to breathe in, just let your body do it for you. Okay, so it's not a, right? It's more of a, okay, so it's just a, and you'll feel it. It'll come from here. It'll come from this really deep place in your body, and it'll go, and it's a nice deep breath, and it's effortless. Okay, that one's my favorite because that one actually I can get to work for me in like 2-3 breaths. Okay, one of the tricks is to kind of pay attention to what's happening in your body as you're not breathing in, because remember, breathing in activates the fight or flight, so we're just delaying that activation of that fight or flight for a little bit longer, and so just wait and see what happens. And so I've had people report all kinds of different sensations. Some people can really feel their legs getting heavier and heavier and heavier and heavier and heavier. Some people just feel this wash of warmth throughout their whole body. Some people say, oh, I can feel my heart beating. Just a lot of really different, but just kind of pay attention. What is this like? What does this feel like? What's going on? You know? Oh, I need to breathe in. No, just wait. What does it feel like? You know? And then when you do need to breathe in, it's like, and that's another way to train yourself to get a good, nice belly breath. Okay.
Yeah. Does that lower blood pressure too?
You know what? That particular technique I have not tried doing blood pressure before and after. I do know that doing breathing techniques will lower blood pressure. I've seen it happen.
How about the eye technique though? Does that
You know, I don't know. That's a good thing. I haven't tried that one before and after either. Yeah, no, I haven't tried either one of those to do before and after. I've just done a lot of like relax. Like at the beginning of a session, I'll take blood pressure. And then we'll do a lot of relaxation techniques, and then at the end of the session, so 45 or 50 minutes later, we'll get up, we'll take the blood pressure again, and it's typically has dropped quite a bit. So
It worked on me, and that's good. I mean, I didn't.
Flo, you want to tell your story?
Even when I got home,
this
my
was
blood
so
pressure
cool.
was really high. When I came here and we worked on the breathing techniques, my blood pressure went down.
Yeah.
And then when I got home, after walking, my blood pressure went up again.
Right.
Very high.
What's it?
And then I used the breathing techniques, and my blood pressure came down really good.
Good.
Because at first I thought I was going to have to go to the emergency room.
Yeah.
It was just that high.
Yeah, it was that high. Yeah, that's scary.
So I think that kind of works. I was really surprised too.
It's fun. It's fun. So we did that. We spent an hour, half hour
Yeah.
working on that. And the other thing that happened, what was the other thing that happened during that session? Pain went,
Pain went down.
yeah, from
And
it.
then when I went from I was like a 8 or something. So
Uh-huh.
I'm usually 7 or 8 or 9. And then it went down. I didn't have any pain when I left the office.
Yeah.
I wasn't in any pain, which is very unusual for me.
Yeah.
Because I'm always in pain.
Yeah. Isn't that cool?
That's
really
really
good.
No, breathing. Pain.
That's really neat.
Isn't that cool?
That's really
So, I mean, and we've seen this happen with several other people, okay? Is it going to absolutely work 100% of the time with 100% of the people? No. We all know that there is no panacea. Okay, we all know that there is no one intervention that's going to work for every single person. But hey, it's worth a try. It's free, right? Breathing.
Worth it, right?
That's true.
Right?
It's free. That's it's free.
It's free, at least for now.
Yeah.
Alrighty, we got 2 more to go. All right, so sorry, this is kind of a little bit longer than I anticipated, but so sleep. What happens to sleep when you're in pain or you're in constant or on a teeter-totter? When one is high, the other one is low. When melatonin is high, cortisol is low. So we kind of go on this teeter-totter all day long, okay? And the idea is that in the morning, this cortisol is kind of like a coffee maker, raises you up, gets you alert, raises up just enough, okay? Wakes you up in the morning, is high, melatonin's low, because you're done sleeping, right? And so as the day wears on, the cortisol is supposed to come down, and as the day goes on, the melatonin's supposed to come up. By the time the end of the day rolls around, you're supposed to be nice and sleepy, and then you fall asleep, right? Okay, that just like never happens.
Yeah.
Okay, that's what's supposed to happen. That's not what happens. Okay, what happens is the cortisol stays low all day, or high all day, or it dips and then crashes, and then it just does this whole thing, right? Where it's very unpredictable. But when it's high, this is your second wind at night. You start to get tired. You get involved in something else. Okay, that increases your arousal. The cortisol comes back up again, and now you can't sleep, right? Okay, this is the 3 o'clock in the morning awakening. Okay, it's on too. Someone set the alarm too early. Okay, this is like I'm wide awake at 3 o'clock in the morning and I can't figure out why. There is no going back to sleep right now. I am wide awake. This is your cortisol speaking to you. Okay, all right. So what's this feel like? Fatigue, memory changes, irritability.
Shut this down. How do we do this?
Okay, meditation and relaxation. Okay, light exercise earlier in the day. You can try insomnia, audio programs, medications, sleep studies, because there may be something else that's waking you up at night. Okay, it could be apnea, could be something else. Okay. I'm also going to say that this can be kind of from an adrenal gland's fatigue issue, and there are some specific diet and exercise recommendations for adrenal fatigue, depending on what stage you're in. Okay, I'm not going to go over those right now because we're running out of time, frankly, and also that was a whole hour that we already did. I may do it again sometime, but it is up on YouTube for the adrenal fatigue. Okay, so that is available for you, but there are some very specific things like that you can do for that. All right. The last one is your nervous system, and this is kind of interesting. I should not have left this for the last day because everybody's ready to go. But basically, we have this protective nervous system, okay? And what it's trying to do is it's trying to simultaneously give you as much information about what's happening around you as possible, shunt information and blood to those bigger muscles, and also it's trying to keep you alive. Okay, so what happens is it stops being as subtle as it needs to be. Who needs subtle when you're dealing with the bear, right? Yeah. Okay, so it stops being subtle. So again, this is part of that motor system. I can't get the cup to my mouth without banging my teeth. I can't reach up into the cupboard without a little bit of a shake. Those kinds of things happen because that nervous system isn't quite firing quite as well. In the brain, things that aren't getting used, like the little postural muscles, the core muscles that are supposed to help keep you upright all day long, they're not getting used as much because all the blood's going to the bigger muscles. Okay? All right? So they're not getting used. So what happens in the brain? When we don't use it, we lose it. Okay? So the maps that are inside the brain then start to smudge a little bit. They start to kind of relax out. Okay? The example of how the brain can change is if you are a virtuoso a violinist, your left hand, the representation, the Google map of the left hand inside the brain is going to be much larger than anyone else's because we're using it all the time. You have to be very, very precise with it, right? Okay? All right. If that violinist stops playing for 2 years, that brain region will shrink back to normal. Okay? Again, the body is very smart. It's only going to maintain what's getting used all the time. Okay? So if we're not using these little postural muscles, we're not going to be able to find them. So when your physical therapist says, okay, pull in your belly for me, you're going to go, pull my what? Do what? all right, I want you to flatten your back on the table, and you're gonna be like, where's my back? I don't even know. How do I act? What do I do? How does that even work? Okay, so that's kind of what some of what's happening is the stuff in your brain is kind of, it's not getting used, so it's getting allocated to other areas. Okay, all right.
So use it or lose it.
So use it or lose it. Okay, so basically gentle reintroduction as to where things are with really super gentle motion. Massage therapy can help. Mirrors, looking at your body. Okay, I know that's not the most fun thing for a lot of people to do, but looking at your body, looking at your back, using a mirror to look at your back. Periodic check-ins. Where am I? Oh, I am slouching. Okay. Periodic check-ins. Where am I with my body? Where are my shoulders at? Okay. Those kinds of things can kind of help to reorient you as to where your body is in space. Okay. All right. One last quick note about brain fog. Most of us have a little bit of brain fog where we just cannot seem to get everybody online.
Yeah.
The way that I heard this described is just, I think, pretty brilliant, is that we have all these different areas in our brain that are associated with a lot of different body processes, a lot of different thought processes. We have a lot of them that are involved in the experience of pain. We have the sensory areas, the motor areas, our problem-solving areas, our attention areas, our visualization areas, like how are we going to get this done? What's that going to look like? All of that stuff is all okay. So all of them, when we have chronic pain, especially if it's really high, all of them have been hijacked. They're all in this pain meeting. Okay, they're all sitting there talking about this pain. All right, they don't have the wherewithal to do anything else. So if your brain's trying to figure out how in the world am I going to get through my day, it's not going to have the guy who's in the pain meeting to be able to figure out how to use the ATM or where to put the keys down, right? Mm-hmm. When you get home.
Yeah.
All right. I saw one thing that was really funny. Of brain fog is putting your keys in the microwave and then putting your pin. Right?
That
You
probably
find
blow
your-
up the entire microwave. My metal, you can't.
I didn't say
Metal
push
with
go,
metal.
but you know, I mean, like it's just one of those things where you find yourself doing the dumbest things because it's hijacked. It's not there. It's in this pain meeting, doing something else, and so that's that experience of brain fog. I thought that was a great way to describe that. Okay, wow, that was a lot of information.